Hema, unmute. We can start, Hema.
Yeah, Hema, I think you can unmute now.
Yes. Thank you so much, Aishwarya. Welcome. A very good evening and a hearty welcome to everyone present here. I'm so glad that all of you made it. You registered and came in for this. My name is Hema, and I'm from the current batch of the one-year diploma program in facilitating governance reforms, which is offered by TIS Mumbai and Barefoot Academy of Governance. A batch of over 20 from diverse parts of the country. I'm currently talking to you from Shillong. We began our course this year on the virtual medium, with some apprehensions in the beginning as to how it would span out. In the virtual space, we now stand today in awe of all that we have engaged in the last year. Suresh, Pradeep Prabhu, and Raghu Anantanarayanan, the founders of this program and our beacons of hope and promise. Through the course's unique approach, we have experiential and conceptual sessions and dialogues. There arose in all of us a feeling of critical consciousness. The dialogues we used to have during our sessions opened up a whole new world for us, where we began to approach contemporary issues in a comprehensive manner. Before this course, governance to us meant just the government and its institutions. But today, each one of us can confidently tell you that it is much more and essentially puts you and me, the common citizens, as its core focus. The course has helped us in exploring governance through the lens of dignity, democracy, and development. It was during these sessions that a few of my batchmates and alumni from the program decided to use the same virtual medium in engaging with more like-minded people. And that's exactly how the Samvaad dialogue series came about. We've had successful Samvaads in the past where we've interacted with Bejwara Wilson, Mr. KJ Joy, Professor Deepa Sinha on multitude of programs. And today, I'm very happy that we have with us Mr. Harsh Mander to start off the two-part dialogue series, which we've planned on COVID and governance. After today's session, we also have healthcare and governance during COVID coming up on 30th of April on Friday, where we'll have Dr. Abhay Shukla joining us. My sincere thanks to you, sir, once again for agreeing to consent and engaging in this dialogue with us. I will now request Abhijit, who is the alumni of the batch, and not only just an alumni, he's been a constant guide for our current batch to introduce the brief parts of the program and take us forward. Over to you, Abhijit.
Thank you, Hema. Hello, everyone. I hope you all are doing okay, whatever the situation is there near us. My name is Abhijit Biswas. I am the alumnus of Barefoot Academy of Governance, a social worker, and also a COVID volunteer. Last year, when COVID hit us, many sections of civil societies and concerned citizens took the lead to support and help those in need. I was one of them. It was difficult to see the pain then, and it is extremely difficult, scary, and sometimes disgusting to see what is happening today. Today, we are here to acknowledge the scale of the COVID deaths and the pain we are all experiencing. We should take a minute to remember all those who have died and empathize with the millions of survivors and their families. While we grieve, we need to move away from pointing fingers and blame game. We urgently need to move towards finding a solution so that this tragedy can be minimized and not allowed to grow. We need to make a conscious choice not to give up until we fix the root cause of the problem. Our nation has witnessed 1.76 crore cases, COVID cases as of today, and over 2 lakhs COVID deaths. As we speak, the numbers are increasing, and the death toll forecast is frightening. Unfortunately, the numbers are also highly underreported. Recently, Chief Minister of Haryana, Mr. Manohar Lal Khattar, said, "Those who have gone will never come back." So there is no point talking about the numbers. I would like to respond to him by saying, sir, these are not just numbers. These are our citizens. someone's loved one, someone's father, mother, sister, brother, and friends. This is not a common talk. This is a serious matter. What right does he has to tell us to not to mourn the passing away of our fellow citizens and seek justice for them? We have all witnessed the horrifying images coming from the crematoriums. Never did I imagine that we will have to witness the long queues of dead bodies. The SOS messages flooding the social media tell the tale of panic, desperation, and fear of people struggling from drugs, inability of drugs, beds, and oxygen to save their loved ones. But we are also witnessing strength, courage, admirable human values. It is for the sake of humanity that we need to understand what caused this disaster and demand accountability. What also fumes me is not just the virus, but the unscientific temperament towards a medical crisis. We banged thalis, lit diyas, and showered flowers. We religiously played our parts only to invite death trippers to our doorsteps. We don't have enough doctors, not enough beds, not enough medicines, now not enough oxygen. What does the system expect from us? That we keep silently burning our people and believe that best is done? We reject this temperament. We reject such apathy towards human life. As if the silence of the dead was not enough, the system is resorting to silence the voice of the living. How long are we going to quietly witness this blatant mockery of democracy? I say enough is enough. We are not going to keep quiet. We will question, we will keep on asking who is responsible for this crisis. Last year, I was asked to volunteer for food. And this year, I got a call to volunteer at the Kabristan, Shamshan Bhumi, the crematoriums. This was a tipping point for me. How did we reach here? The virus does not discriminate. Today, it is someone else, and tomorrow, it could be you and me. But can we also think about the majority of the population who does not have privileges like you and me? If you do not have connections, reach, access to social media, chances are you might not find a hospital bed. If you find a bed, you have to be very lucky to get a medical attention, proper medicines, and most important is a cylinder of oxygen. If you can recover from the disease, can you recover from the financial stress? It would be naive to say that it is all because of the coronavirus, as if our healthcare system was doing great before the pandemic. Today, we need to analyze this problem deeply. We have to ask critical questions about our health policies. Is our health policies inclusive, and does it care for every citizen of the country? What measures were taken to improve the health infrastructure before and after the first wave of COVID? Where do we stand in terms of transparency and accountability in our healthcare sector? How do we plan to vaccinate our 1.38 billion citizens? Are we not practicing vaccine apartheid by putting a price on COVID vaccine? Wouldn't privatizing vaccine immunization leave behind a large section of people? Is this acceptable to all of us? Let us not forget that we eradicated polio and smallpox through universal immunization. Why is there a need to privatize now? Remember, this virus does not discriminate. If all are not immunized, no one is safe. To get a much deeper understanding of these pertinent questions and issues, I would like to invite Mr. Harsh Mander to share his personal and professional insights with us. Above everything, we know him as a compassionate human being and someone who always cared about people. With a background in administration and social work, sir, I'm sure you have seen governance processes much closer than many of us here. Let me start by asking, what is the reason for the COVID deaths? Is it just the virus, or it is a governance failure?
Thank you. Can you all hear me?
Yes,
thank
sir,
you.
we can.
Thank you, Hema and Abhijit. Thank you. I think you summarized a great deal of what I would want to say. I also want to say it's a privilege. Suresh, Pradeep are very old friends for whom I have great admiration. I also see Gopinath Ji, and I see a lot of you here for this conversation. Let me start by saying it is not the virus that has brought us to this point. It is governance, it is public policy choices made over the last year and indeed actually over the last decades. And I'll try to explain why I say this. I wrote a book actually almost from the second day of the nationwide lockdown last year. I was on the streets because I work with homeless people and also with the riot victims in Northeast Delhi. And I knew how devastated they would be, without the opportunity of they eat what they earn every day. And from the streets, the horror of what I saw unfolding. Today we see the burning pyres on pavements, on parking lots. We see families desperately going from hospital to hospital, seeking beds and oxygen. We see huge, actual frank privatization. We are alone in the world for privatizing even our vaccine program. But I think this is part of a larger collapse, both of accountable humane governance and of democracy itself. In fact, this afternoon, I finished an op-ed for the Indian Express where I've made some of these arguments. But let me start, step back a little bit. When the Prime Minister announced the lockdown, with 4 hours notice more than a year ago, I was watching him with despite everything, with utter disbelief. Because here was the Prime Minister telling us to stay at home and work from home. I said, and to keep social distance and to wash our hands regularly. I said, has he forgotten that there are large populations with no home, or, in cities, the greater proportion of people living in one-room tenements? How are they going to keep any kind of social distance? 100 people share one common toilet. They don't have running water. How are they going to wash their hands? He was clearly not talking to them at all. He wasn't thinking about them at all. He was talking to the middle class, to you and me. And he was talking to us as, that I'm doing all that I can to protect you. And then we obediently banged thadis and lit candles and so on. In a sense, we were complicit in the exclusion of the poor, the working poor, from the responsibility of government and governance, because we felt safe. And this is my theme throughout. It is the rich and the middle classes, the elite. I'm holding government accountable and responsible. And I wrote a book through this, through the months of the lockdown, called it Locking Down the Poor, where I've said that the actions of the government were actually, with history, we will recognize them to be crimes against humanity, genocidal in character. And these are very strong words, and I hold on to them. And I think a little bit of what we are witnessing today is bearing this out. But I think we need to go to the depths of where we have lost our way as a republic. And many things. Let's start with the health system itself. India has one of the most privatized healthcare systems in the world. It wasn't always like this. My father was an IAS officer, and I remember as a child, we would only go to government clinics. I don't ever remember actually going to a private healthcare center as a child. We systematically demolished whatever, instead of strengthening, we demolished our public healthcare systems. And for urban poor, it's even more so. I was asked by the last government to chair a committee, which was how do we make health services work for the urban poor? And I discovered, to my shock and surprise, that we don't have in almost across the country, including Kerala, incidentally, we don't have primary healthcare facilities. In rural India, we have them at least in theory. In urban India, we don't even have them in theory. And there is no primary healthcare. If there were, if the recommendations we'd made had been put in place, there would have been a system of response. But there isn't any. The statistics are shocking. Let me just share one or two of them. 80% of trained doctors who live in this country, and this is actually, it ignores actually a very large number of doctors who are trained at taxpayer expense and who go abroad. So leaving them out, I mean, those who live in India, 80% of them work for the for-profit private healthcare. It's only 20% who work for the public health system. Now you suddenly, and all of this while we in the middle class were happy, we were saying, how do we need these terrible public clinics? We will get the best healthcare in the world through our money and our health insurance. And we were assured that we don't need a public healthcare system. Although the whole world now has realized that the Thatcherite Reagan kind of demolition of the public health system was disastrous for people at large and for the poor in particular. But we are still with that same orthodoxy. So we spend 1% of GDP on public health, and much of it is actually for super tertiary kind of hospitals like All India Institute, but not for primary healthcare for the poor. And we spend, double of this amount is out-of-pocket expenditure. And we were told that, we were assured when we complained about this, and you were saying Abhay is going to talk to you at more length. We were assured that you don't need the government systems because everyone will have health insurance and you'll get the best healthcare system by paying for it through your insurance. But we've seen now that when the crisis really hit us, even the most generous estimates say that the private healthcare system has not contributed to more than 10% of COVID response. So 90%, and much of that is also at very high extortionate prices or to chief ministers and union home ministers and such like, who check into private. I think it's an act of such great public immorality that they don't have faith in the public healthcare systems that they are supposed to operate for the poor, and that 90% of the COVID response was left to 20% of the trained doctors in a completely starved public healthcare system. We saw this a year ago, and it was very obvious to me that you could not respond unless you nationalized. We had to nationalize the private healthcare system, at least for the period of the emergency. Countries like Spain did it. Every trained health personnel and every equipment bed across the country was to be for the public good and not for private profit. We just don't have, we have a government that even today, when we see the oxygen and vaccination crisis, each one leads us to government decisions that are that seem much more concerned to protect private profit even at this stage rather than the public good. And this is the cumulative impact of all of this. I mean, oxygen production should have been nationalized. Vaccine production and distribution should have been nationalized. There should have been free and universal vaccines assured for every person. But we are imagining a very different country from what we in the middle class, you and I, have actually celebrated. And we must recognize our own culpability. The government that we have, the public policy choices that have been made by this government and previous governments have been supported and celebrated by us. And our own culpability and our own lack of caring, we felt we had escaped. We have in our own stratosphere, we would have the best private schools, private hospitals, private transport. We won't need public services, and what happens to the poor, we don't care. And I think that is really what we're seeing the outcomes of. In my limited time, there are a few other things that I want to focus on. The second cumulative impact that we are seeing today is the absence of labor rights and labor protection. 9 out of 10 workers are informal workers in this country, even today. It's a matter of enormous shame that they work under conditions of no labor protection. Neither their wages nor their employment is protected. And we are told that this is what we need for growth, for development, and for labor interests. When I was in college, there were 2 books. One that we claimed to read, but probably did not be able to go through it, which was Das Kapital by Karl Marx. But another book that we would read was a small book by Schumacher called Small is Beautiful. And its subtitle is absolutely beautiful. It is Economics as if People Matter. I mean, what is the point of high economic growth if it does not help improve the access of the poor to basic public goods? We're told China and India are relatively equally unequal. But what we miss out, as Amartya Sen has pointed out, is that if I was at the bottom 10% in China and in India, at the bottom 10% in China, if my child fell ill, I would still have access to a decent free public hospital. I would be able to send my child to a decent school and ensure basic nutrition. The penalty of inequality is much greater in India because of the failure of the state to provision even basic public goods. And I think that is the second, apart from the neglect of public health, the absence of labor rights completely is spectacular. When after the lockdown with Prabhat Patnaik and Jayati Ghosh, I wrote a couple of op-eds and also went to the Supreme Court. And we were saying that if people in the formal sector are getting wages for staying at home, elementary justice requires that the state also provides the equivalent of minimum wages to every informal worker in the country. And we calculated, and I was surprised at the figure, that if we had done, which was about 7,000 rupees per household across the country through the lockdown and beyond, it would have cost us about 3% of GDP. The actual transfers that our government made was less than 1% of GDP. We must look at even the most market fundamentalist of governments in the West, the United States, the UK. All of these made much greater provisions of direct transfers. Japan had as much as 20%. And the irony is that if we had made that 3% transfer, the suffering of the poor would have been much less. The desire to migrate at all costs and return home would have been much less. The spread of the virus would have been much less. And most strongly, the impact on economic recession would have been much less, because we wouldn't have crushed, overnight we crushed all of supply and all of demand. It's never been done in this way in human history, and we're seeing the consequences of it, I think, for a very long time. I'd like to really contrast with two countries with which we are often hyphenated. China, even at its peak, China originated the idea of the lockdown, but even at its peak, it locked down 5% of its population. We locked down, when we had just 500 cases, 100% of our population, without any thought of its consequences. But a much more stinging comparison is with Pakistan. Pakistan I've been to Pakistan a few times. It's a very, very poorly governed state. All that happened was that when India went in for a nationwide, very strict lockdown, when Imran Khan it was suggested that Pakistan follows the same course, he made a statement which stays with me. He said, if we were an industrialized country where workers had social security and so on, and housing, and we could have thought about it. But what will happen to my poor people? These were the words he used. What would happen to my poor people if we went in for a lockdown? They eat what they earn every day. It would just destroy them. Here's this playboy, elitist person that we dismiss. He just showed elementary human compassion. And let's say actually that they did virtually nothing, and there was no lockdown, there was very few measures. But if you see the outcomes today, Pakistan's performance, both in terms of economic growth and in terms of COVID control, has been much better than India. Of course, we have much finer examples by countries, insignificantly, most of them led by women, from New Zealand, Germany, Finland, Denmark, Taiwan, and of course, countries like Vietnam are much poorer than India, where we have shown how these were not problems and Korea, these were not problems that were unsolvable. Korea didn't even go in for a lockdown, but what it did was test, trace, track, and so I have limited time. We'll have questions and answers. What the public policies choices that we've been making over the last decades through neoliberalism, and the cruelty, the sheer cruelty and callousness of imposing a total lockdown overnight with almost no relief, is going to has caused a humanitarian crisis larger than I think any of you, most of the people in this audience, would have seen in their lifetime. Certainly the largest in half a century, and it is still unfolding. Jobs have been destroyed in the micro, medium, small industrial sector. There's something that Ravi Srivastava said, which always stays with me, and he said that we talk about what happened to labor in terms of migrant workers and their rights, etc. All of them were destroyed, but he said something more fundamental got destroyed last year, and that was trust. He said that the workers knew they were being exploited. They knew they weren't getting their due, but they believed that when things get really bad, our government and our employers will take care of us. And what they realized was that when the crisis came, both the government and their employers threw them to the wolves. That trust has broken down. And yet we found within months, people have started coming back. Spoken to many migrants who've come back. Their hearts are broken, but they say we cannot see our children dying of hunger. They're largely remittance economies, the rural areas. We have to work under any circumstances. And now it is not just with exploitation, but without trust. And I think that is what we're seeing. One last thing that I'll say and end here. Arundhati Roy remarked in a conversation with us something very, very profound. She said, COVID-19 is a virus, but it is also an X-ray. It's an X-ray of our society. It has revealed to us who we are as a people. And I think that it is that X-ray that I would invite all of you to look at unflinchingly. What have we, people of relative privilege, what country have we built? What country have we celebrated? What country and kind of governance have we supported, which excludes the poor? And I think that there have been individual acts of solidarity and kindness, which I've written about in my book. On the streets, I was touched by young people who were risking their lives. Again, it's happening. Abhijit was talking about his duty at food last year and cremation grounds this year. These are acts that still show that the humanity in our society still survives. But these are still exceptions. It is not how, we've written into our constitution a word fraternity. In Hindi, it is bandhuta. हम एक दूसरे से बंधे हुए हैं. Your pain is my pain. Your suffering and loss is my suffering and loss. And unless we build a society, we renegotiate our social contract with the working poor, that their children and our children deserve similar opportunities for the future. They need good schooling. They need decent housing. In 1894, there was the plague in Bombay. And it's remarkable if you read, this is a colonial administrator, they said that there are only two things that could save people from a future epidemic of this kind, and they come completely free. And what are these? He said clean air and clean water. And he talked about building a city and a country in which we assure every worker clean air and clean water. And look at where we've reached, these centuries later, century and a half later, and how much, how little have we assured of a minimum decent life to the very poor. This is the X-ray that we must look at and decide if this is the country, this is the world that we now want to leave to our children. Thank you.
Thank you, sir. Thank you, sir, for giving us this broader idea of what and where did we go wrong. I think few of the words which I'm taking from you is human governance. And often in our course, we talk about keeping people at the center of the governance and then deciding the policies and designing the governance processes. You talked about 90% of the COVID response left to 20% of our doctors. That's a very, very alarming thing. And I think that's something we need to really think about. You also talked about nationalizing healthcare. I think already there is a question from Selvin in the chat. We'll come to that in some time. As this platform or this gathering has been designed or been arranged, not only to listen what is or where we are going wrong in this entire disaster, but also an opportunity for all of us to share in our opinion, our insights into this. If you have any questions, feel free to ask and share your experience. So what we can do right now is that I would like to invite all the participants in this call to raise their hands if you have any questions to share, if you have any opinions to share or insights to share. You can directly to Harsh sir and he can respond, or others can also respond. So feel free to raise your hand. There is a button in your screen which says reaction. There will be another button says raise hand. Once you raise hand, Aishwarya from our team will unmute you. You can raise your question. Be mindful that we are not here to blame anybody, which I have already informed. We are not kind of using any profanity for anyone here. Second is, pardon me if I stop you within 2 minutes so that everyone gets some chance to share their opinion. Yeah. Aishwarya, I can see Praveen raising his hand.
Praveen, you can speak. I've unmuted you.
Please switch on your video also, please, Praveen.
Praveen, are you still with us on call? Okay, okay.
We can't hear you, Praveen. Just check your phone. Might be we can come back to Praveen. Senthil has also raised her hand. We can unmute her.
Senthil, yeah.
Hello, hi, I'm Senthil. I have a question regarding this pandemic and all the things what we watch in news. It sort of pushes us to a helplessness, and so in that way, if I live in a town somewhere south in Tamil Nadu, I I also want to go to the hospitals and see if I can help out anyone who's looking for beds or something like that, but there is not much information about availability of beds or whatsoever. But as a citizen, like, what is there in my limit to really work on? What should be the data I should have? What should be the rights I should have in my community? Or what do you think as the Indian public should do apart from just watching the news? Thanks.
Okay. Thanks, Antil, for the question. Let's take 2-3 questions, then Harsh sir can respond to that together. Is that okay, sir, with you?
Sure.
Yeah.
Sure.
Praveen? Aishwarya, please unmute Praveen.
Yes, I have. Praveen, can you speak?
Yeah, am I audible now?
Yes.
Yeah, you are.
Yes, sir. To what extent is it fair to blame the central government only when the public health is in the state subject? And not even a single state had a system in place in how to deal with black marketing, a dashboard for the available health facilities, even after the first wave has ended, right, 6 months back. And also the right we need to blame right somewhere to the citizens also, right? There has been a brazenly right lack of proper civic sense which can we see from the large section of our population, right? So they should also be a kind of a partners to take the blame, right? Rather than single outing to a single person or a single system.
Yeah, thanks, Praveen. I think Aditi, please unmute Aditi. Let's take this one and then go to responses. We'll come back again.
Aditi, if you can, please switch on your video. Yeah, great. Thanks.
Yeah. Hi, sir. Thank you so much for this session. So I have a few questions. So firstly, I mean, in my understanding, most of the work that's going on is by volunteers and community work, where we're trying to collate verified resources and things like that. But I feel a gap in the understanding of what a verified sort of resource means right now, because it's mostly linked to availability. So how do we kind of ascertain what the allowed price for something that's required for COVID care should be across the country? And is there a way to kind of standardize this?
Thanks, Aditi. Sir, if you would like to respond, and then we can come back to questions again.
Yeah, thank you. Very thoughtful questions. Senthil, let me start with you. The sense of helplessness. What can I do as a citizen? I think it's a very important question. I feel that, there are many ways that one can answer this question. And there are many ethical systems, there are philosophical systems. Let me actually tell you something that Prophet Muhammad said when he was asked a similar question. When you witness great injustice and suffering, what is your duty? And what he said was, at the very least, respond from your heart. Care. The better among us also respond from their tongue, which means they speak out against this injustice. And there's some of us, the finest among us, who respond with our hands, which means we act against this injustice. My problem with what we have become as a society, particularly the middle class, is how little we care. And even if enough of us cared enough, when the Prime Minister was speaking, we know the conditions of the poor. Why didn't we feel a sense of outrage? Why didn't we say this is wrong? So I think that it is because we become so comfortable with our own privilege, and people said, where have all these migrants, laborers come from? You don't even see them, but our life in the middle class in a city is completely dependent. I mean, from the time before you open your eyes, somebody delivers your milk, somebody delivers your newspapers, someone comes into your home, cooks your food, sweeps the floors, takes care of your children while you go out to work, somebody drives you to work, and so on and so forth. But I've often felt is that we look at the poor as if they exist for us. And I wish we wish that we had some kind of Aladdin lamp. We just should rub the lamp and they should appear, provide us the services, and then we should rub the lamp and they should disappear. They shouldn't have needs. They don't have children. They don't have dreams. They don't have aspirations. They shouldn't need housing. We nurtured a kind of acceptance of inequality. I wrote a book called Looking Away. Inequality, prejudice, and indifference. It is this indifference. That's why I wanted to begin with caring. At least feel pain in your heart. And I think that once you do that, some of us will speak out, some of us will act. We are struggling with this question ourselves. The enormity of the crisis, what you can do as civil society is very small, but it is very important. It's acts of solidarity. And I think I learned most even while I was on the streets from the very poor. I mean, I saw homeless people. I recall this conversation third or fourth day, and I said, "How are you managing?" And he said, "I had a little money saved up and I'm all alone. And so I'm buying food, but I'm not buying food only for myself. This family which sleeps next to me have small children. I don't even know them. But how could I eat when the children were hungry? And so as long as my money lasts, I'm taking care of them as well as taking care of my own food." I saw enormous acts of, many of my younger colleagues were on the streets with me. I remember again asking them, "Aren't you scared of the virus?" And they said, "Yes, we are scared, but much greater than our fear is their hunger, and therefore we must be on the streets." I want to record that 2 days ago, Dr. Pradeep, he was a medical doctor, a comrade who has for the last decade been working with us with the homeless. He ran a COVID clinic with no care for his own health. He finally got COVID and died because he couldn't find a hospital bed, and he died because he didn't get oxygen. It is examples, and there are many examples. As a society, that is what we need. I mean, we never called it food charity. We called it food solidarity. The idea of solidarity is where we are equal people. The Khalsa Aid has come in and they said that they've started an oxygen langar. And they're doing, these are acts. It is still a very tiny fraction of what, given the enormity of the problem. And this time we're feeling even more helpless. We had anticipated some of this problem and collected about money for about 8 oxygen concentrators, which we're trying to send out to people. But it's less than a drop in the ocean. But I think these acts of solidarity are important. But what else can I do as a citizen? I think it is, as I said, look with honesty, with courage, unflinchingly at the X-ray that Arundhati Roy talked about. And don't, if we have been complicit, and I wrote in my article today, the Republic has broken down, but we are expressing outrage because we are worried about our own loved ones. But over the last several years, when hate was mounted, when people were being lynched, when just a month or two ago, a young boy, Muslim boy, was thrashed because he went into the precincts of a temple and because he was thirsty and wanted some water. When dissenters are being charged, charged with criminal conspiracy, including myself, insurrection, when we're finding some of our best minds and hearts, young and senior, are in prison. Where is our outrage? Is our outrage only going to occur when we feel directly affected? And I think that as a citizen, to observe, to analyze, as a watchdog, and to speak out. Use your tongue, use your hands, and always respond from your heart. Praveen said, should we only blame the union government? No, we shouldn't. Should we blame the ordinary public? On the ordinary public, I would like to say that this is a time when, what did we see? We saw our Prime Minister and our Home Minister having rallies, unmasked, with tens and thousands of people unmasked. And then you're saying, please wear masks. What messages are we getting from our leadership? We allow the Kumbh Mela, which is the largest gathering in the world, religious gathering, in this pandemic. We still not called it off. So I think that I think the citizen did let her and his guard down, but they took the cue very much from the leadership. Yes, should we only blame the union government? The trouble is that the Prime Minister has converted governance into which, he didn't, when he announced the lockdown, it still is a mystery who he consulted. He certainly didn't consult his cabinet. He didn't consult the chief ministers who were affected. There's now evidence that there were committees of epidemiologists who had given a very strong view that a lockdown would be disastrous in India. They were not consulted. So everything has been centered around the hubris of one leader. And we cannot then say, when things go wrong, that why is he being held responsible? When I was on the streets, continuously people would use one term. They would always say, Modi ji. They would ask questions of Modi ji, and they would ask very fundamental questions. They said that Modi ji कहते हैं कि भीड़ में हमें अगर जाएंगे तो हम मर जाएंगे. तो लगता है कि वो चाहते हैं कि हम मरें, क्योंकि the only food that we can get is when we crowd around, come out every day and stand in lines, pressing against each other. There's no other way that we can get food for our families. They asked, doesn't Modi ji understand that, that if we are hungry, we will be much more prone to the virus? They asked, we are supposed to be not crowded, but the kind of quarantine centers that they packed people in, where tens of people were packed body against body. Is that going to save us? So I think that that there has been a set of decision making led by the union government, the absence of any kind of relief, of any significant relief that I spoke about. These are decisions taken by the central government. But state governments are also responsible. And I would also underline previous governments. After all, the privatization of healthcare did not happen over the last 7 years. It's something that has happened through the last 20, 30 years, supported by successive governments. And all of them are responsible. The denial of even basic rights to labor did not happen just over the last 7 years. Yet, I thought after the migrant crisis and the suffering that was visible to all of us, at least the government would token, bring in some social security measures for labor. But what we found was that they brought in legislation that dismantled even the few protections like an 8-hour work day that existed. We found that allocations to public health, actually, when you did the sums correctly, if you took out the vaccine amount and water and sanitation, which was earlier separately, we found that there has been no additional allocation for public health. So we are not even learning lessons even at this height of this crisis. And I think that we have to hold our present elected government responsible primarily for this. And we have to hold ourselves responsible for the kind of, we seem to celebrate, this is a phenomenon around the world we're seeing. More and more people are choosing, these are elected autocracies. But let us remember, Hitler was also elected, and he was wildly adored by the majority of the German people. That doesn't make legitimate the actions that he took. And generations later are asking, of the German people are asking, how did we allow it to happen? They're asking their parents, they're asking their grandparents. And I'm quite certain that later generations are going to ask us, they are going to ask me, they're going to ask you, how did we let this happen? Aditi talked about standard protocols. Yes, standard protocols are important, but standard protocols need to be developed, which I see every decision is either completely arbitrary. I mean, nobody explains to me, for instance, why you need a night curfew. As a district magistrate, of course, in a law and order situation, night curfews make sense. But in a health emergency, do you have some secret scientific papers that show that the virus suddenly, after it becomes dark, becomes more active, and that's where you have night curfews? I mean, nobody is explaining. And the difference with the with the countries that have done best and the women leaders of these countries is that they would explain everything to people. They were available in press conferences. They would answer questions. They would explain what they are trying to do. They would make people partners in that exercise. We're not seeing that happen. And many of the decisions that I see seem to be more concerned with preserving private profit, whether it is in the non-regulation of private hospitals and the kind of extortionist rates that they are charging, whether it is in the question of oxygen production and distribution, whether it is in the production of vaccines, at least in this health emergency where literally lakhs of lives are at stake, can we place the public good over private profit? We're not seeing a government doing that.
Thank you, sir. We have a few more questions coming up. We have Sayantan, Deepak, and Pritish. Sayantan, if you can come in.
Am I audible?
Yes, you are.
Yeah, thank you, sir, for that lovely explanation. My question is more towards a local versus global context. So we see the pandemic raging on in these first world nations, kind of 4 or 5 months ahead of India, where when we were enjoying a kind of lax period, then the foreign nations were having their second wave, and at that time we practiced vaccine diplomacy, as I like to call it. But well, my first question is, how effective or how meaningful was that tactic? Was a second wave not expected? Was it catch us off guard? The second point, it's also a question which I saw in the chat, and I'm trying to paraphrase it, is that when we see a foreign country, maybe a northernized developed country, act in a particular way, what are the best practices we could take to contextualize in our context? What would be some ways to guide us towards that? Is there any framework in governance, or is there any way we could judge that before actually implementing that and finding out how it pans out? Yeah, thank you.
Thanks, Sayantan. Deepak?
It will be good if they can identify themselves, where they come from.
Am I audible?
Yes, you are. Yeah.
I'm from Mumbai. Thanks so much, Harsh, for the earlier conversation and the response to the questions. Two-part question. The first one, any specific insights on how this government reacts to criticism and the role that has had to play in everything that we've seen in the last 7 or 8 years? Anything differently this government does in terms of its reaction to criticism from what you've seen in earlier governments? That's the first question. And the second one, indulge me a little more in the second one. I'm going to change tracks. It is said that India, unless it's pushed to the wall, doesn't take the right decision. Do you see any bright spots coming out of this crisis? Policy-wise, government-wise, us as a society-wise, education-wise, economic growth-wise, do you see any bright spot? And I understand it's going to get worse before it gets better, but Harsh, do you see anything positive coming out of this unprecedented crisis? Two-part question. Thank you so much.
Sumana, can we have Sumana's question?
Good evening, sir. I'm from Hyderabad. I'm not very comfortable opening my video, so sorry for that. Actually, you have compared India to other countries, and I have a question. How fair is it to compare India to other developed and small nations, given the population size of India? And also, what would be an alternative instead of a lockdown when the world was uncertain about how to tackle this virus, and how else could the government, tackle the rising numbers if not for a lockdown? Like, what was another alternative we had? How could we control the population? And also because the second wave is primarily because we have opened everything up. We had theaters and malls open in full capacity, and that is the reason we are suffering now. So if not for the lockdown, wouldn't the same situation, wouldn't we experience the same situation a year ago? Thank you.
Thanks, Sumana. Sir, can we take a few more questions and go ahead together? Harsh, sir?
As you like, no, I think these are thoughtful questions. I'll try to answer them quickly.
Sure.
I lose track with them. Firstly, Sumana's question. Sumana, it's an important question. And many people say a lockdown was necessary, and it's unfair to criticize it for its consequences. My point is that the lockdown was not even feasible for the large mass of our people. So if you can't work from home, you don't get your salary and wages when you stay at home. If you can't keep physical distance because of the way that you are forced to live, if you can't keep radical hygiene, it was actually a strategy that excluded, even by design, the poor. And therefore, it was not, to my mind, it wasn't an option for us. It should not have been a moral option for us. Mahatma Gandhi, long time ago, in fact, a few months before he died, said, when you're in a state of confusion, think about the poorest, most vulnerable person you know, and think about what the impact of your decision would make on that person's life. And I think that if you use that talisman, you could never have gone in for the kind of lockdown that we went in for, because it would make life much worse for the very poor. And I've borne witness to it. I've written about it extensively as well. What could have been the options? There would have to be very different options. I mean, of course, you should have closed cinemas and regulated, the crowding of places. We should have been fair in stopping the Kumbh Mela as much as we stop other religious gatherings. We should not have had political gatherings of the kind that we have. Those precautions should have been taken. But otherwise, testing, and this has been repeatedly said, the best response would have been testing. That, like South Korea really had, you could go to any metro station, you could go to a bus stand, anyone would be tested, free at state expense right from the beginning. And as soon as you test positive, your contacts would be traced, and there would be quarantine facilities and so on. Here we were not even, we are testing very, very reluctantly, and almost not at all for the poor. I'll just give you an example from the homeless. We were finding that there was no testing of the homeless at all. And we kept approaching the government, the Delhi government, and saying that how can you exclude? And when they said that we just can't do anything about it, we said, allow us to test. And they said, no, we will not allow you to test either. And we set up a COVID clinic. We would identify people. We'd have to take them to the government setup. They actually said, we will not test people unless they have an Aadhaar card with a Delhi address. And I said, how absurd can that be? I mean, if you're trying to control the virus, homeless people, most of them don't have any documents at all. But even if somebody comes from Mars and has the virus, in order to protect yourselves, you must test that person and treat that person. So they said that they gave up. They said, we have a policy of home quarantine. I said, how can you give up a policy of have a policy of home quarantine and no other quarantine facilities when so many of our people don't have homes or don't have homes where you can quarantine? So I think you must recognize that it was the design, and lockdown also made sense if you were creating the health, all that, the hospital beds, creating of new hospital beds, creating of, getting equipment, getting ready. That was the other justification. We're seeing where we are on that now. The Prime Minister announced we've created 1 lakh new beds for COVID. It's as he often is, he was being very economical with the truth, to put it politely. What we were not doing, we didn't create new beds, we repurposed. So, you had the dramatic example of Bombay, where cancer patients were taken out of the cancer ward and made to lie on mats under an overbridge. A treatment of many other illnesses was just wound up and replaced by COVID care. That's not what we mean. And we could not create more beds unless we nationalized, because unless the 80% health personnel who work for the for-profit sector were available to us, you cannot create beds without equipment and without health personnel. And we had to take those hard decisions that we did not take. So I think that responsibility is there. You said, Deepak, how does this government respond to criticism? I'll just come to that later. Any bright spots coming out of this crisis? I'm speaking out, and I'm accepting invitations of this kind. I wrote a book. I've spoken in many places. I think that if we do not learn from this crisis, I mean, if we don't look at that X-ray that is being held up before us, honestly, unflinchingly, and decide to build back better, why are we not outraged that we are not now still investing in public health? Why are we still not, giving greater protections and labor rights to labor? These are 2 examples that I placed before you. There are many others that we could talk about. Social housing. If in 1894, colonial administrators said that unless you have decent housing with clean air and water for workers, they will always be susceptible to epidemics. Unless we learn solidarity, and if we feel, the thing is that we are continuously feeling that somehow they're going to protect us. So we'll get the vaccines because we can pay for them even when the prices are raised. We're not still outraged that a priced vaccine policy, which is one of the only ones in the world, even the US, etc., have free vaccines for all, and they've covered a large part of the population. We still feel, okay, we'll get protected, but let others, we don't feel. But in the nature of an epidemic, unless everybody is protected, we are not protected, apart from the moral question. I mean, it doesn't make sense that we will get vaccinated and large mass of the people will not, and we'll feel protected. Simon, you asked about second wave. Was it not expected? Of course it was expected. It was, and the signs were very clear. It was being warned for a very long time. And we were completely unprepared. And when we look at the answers, we find that a lot of it was to do with private production, who gets a tender, who doesn't get a tender. Once again, private profits seem to be given far more, apart from sheer incompetence. Lessons from some other countries, there's many lessons, but because I work with the homeless, let me share something very interesting. I was looking and I was talking to friends who work in London, for instance, from the University College of London with homeless people. And they told me something. This is a right-wing government in London. I said, what's happening with the homeless people? And they said that they're all in hotels. So I said, I don't understand. And they said 7-star hotels, 5-star hotels, every hotel has been taken over by the government. And homeless people are being housed, not a single of them are on the streets. They're living in hotels paid by the government. The hotel industry is saved, and the homeless people are being protected and given a decent opportunity. When I heard this, and now the US is also doing this, I said, how long will it take for us? Can you imagine an India where in Delhi, in Taj Intercontinental, we'd have homeless people living as their right, with dignity, paid by the state. So there are examples. I mean, there are many examples, but this was a spectacular one that I wanted to share with you.
Thank you so much, Harsh. I think when you were saying the last thing, what came to my mind was, unless and until we have a policy which says every life matters, I think that's the core. That's the message I was getting.
And every life matters equally.
Exactly, and dignity, and that's so crucial. Which I think somewhere along the way we're missing out on that. So we also have some questions from our live streaming. So I'll just put it up now. Then we can take the ones who are there with us. This is from Sarvan and Karunanidhi. Do you think not giving more powers to local self-governments for so long in large part of this country is also a major obstacle in handling COVID crisis? And in your observation, how the southern states have been responding to the crisis, to the first and the second waves? This was from Sarvanan. I think we can now take up Simran, maybe if you.
Thanks, Hema. Hi, Harsh. This is Simran joining from Jaipur. I work on governance issues in energy sector, and in our work we often try to work with people, but more importantly we work with institutions, right? And power sector institutions who are expert at regulations, policy, and technical and financial expertise also. And healthcare itself is a pretty complex sector itself, especially during a crisis. I am left wondering, where are our institutions, right? Decision making and is what I'm seeing is still very political. Is chief ministers meeting with the PM? Where are the experts coming together and coordinating with each other and leading it from the front?
Yeah, I think if Aditi, if you don't mind waiting a bit, I think we have Pritish who's also been waiting. If you can have Pritish.
Ma'am, I'm not able to start video.
That's okay.
Yeah. Hello, sir. Myself, Pritish. I am from Dhule district, Maharashtra. I am a media student from Ferguson College and UPSC aspirant. So my question was this. It might sound a bit off track. I was going through a summary lecture of polity on YouTube, and there this professor said this statement that if we see a historical background of governance of India, During British's time, executive was one controlling the nation and legislature was under them. But now it is vice versa situation. So, sir, if someday these things again change, and if someday executives run the democracy, will we lose the sense of democracy, and these ideologies in disguise of legislature will try to prove why executive running democracy is wrong?
Thanks, Pritish. And Harsh, I think just again to just quickly put in, we also had the second part of Deepak's question about criticism. Maybe if you could just.
Yes, of course, I need to come back to that. Maybe I'll end with that. Sarvasan, sorry if my pronunciation is wrong. I do think that what we've seen destroyed is any kind of respect for federal authority. So the problem had to be dealt with by the states, but they were never consulted. Except now, when everything is going wrong, suddenly the states are responsible for everything. Without the corrective of how are they going to respond without the resources. The states are being told they'll have to negotiate with the private sector and fix prices for vaccines. It's absurd at this point. So certainly we needed to have a far more and Simran also talked about the experts. In my book, I done an extensive documentation. We had committees, we had we've had systems to deal with epidemics, and the experts were there, but they were not consulted. Their views were not borne in mind. For instance, about the nature of the lockdown, limited, containment zones rather than large lockdowns, etc., what they had proposed. All of that was ignored. And so we do see the crisis having happened because both the federal character, the institutions, the experts, and among other institutions, let me also talk about the Supreme Court. I had taken a petition to the Supreme Court with Prashant Bhushan, and Anjali Bharadwaj was the co-petitioner, where we said there must be food and cash transfers through the crisis of the migrants. And the singular lack of any kind of response from the Supreme Court, even at that time of crisis, where the suffering was visible very clearly. At one point, the Solicitor General said, we are ensuring enough food for everybody in the country. And the data that they gave, actually, the food that was being distributed, more than half of that data came from just two states, which was Delhi and Kerala. And what about the rest of the country? And we pointed it out, but clearly, and the numbers of people who needed food and the numbers who were covered, there was a huge gap. But the Supreme Court refused to intervene. But at one point, the Chief Justice actually made a remark, and I've already been pulled up for contempt by the same Chief Justice, and I invite him to do it again. But what the Chief Justice said, actually, he said, we had said cash transfers. So he said, the government of India says everybody is getting food across the country. We believe the government of India, despite everything that you say. And if they're getting food, why would they need cash? And I really wanted to say that, Chief Justice, sir, if that is how you feel, then I undertake to send you a tiffin carrier of the best food, lunch, dinner, and breakfast every day. You should not accept a salary. Somehow, in our institutions, when I go to the highest court of this land, I'm expecting justice, and true justice is always tempered with compassion, which I found singularly absent. And we're treating the poor as if they're some other species. We are another species, and they are another species who should survive on handouts. I mean, to have to spend every day, even in Delhi, which was distributing food finally, you would have to wake up in the morning and stand in line in the hot sun, sometimes 2 kilometers long, wait for 3 hours, get a plop of food, go home, rest for a bit, come back, and again sit in a long line waiting for food. You've reduced people who've always worked. You've reduced them to almost the status of beggars. If I just sort of hypothetically say, suppose the Prime Minister ordered the lockdown, but said nobody will get a salary, during this period. And no one would, get the protection of their health insurance. How would we have reacted? We would still have had the comfort of our homes, the safety of our homes, of running water. Would we have accepted it? And we would have been outraged and angry, but we thought it fitting for the poor. So, yes, Pritesh, your question is very interesting. I don't think that we are seeing a situation in which the legislature is dominating the executive. Quite the contrary, we are seeing every institution, including the legislature and the judiciary, every countervailing, and the media and academia and civil society. All of these were supposed to be counterbalances to executive power. And I've argued that in the article today that I wrote, that what we have witnessed and witnessed willingly, and a lot of us have celebrated it, is what is really an elected autocracy, where the executive is unencumbered and unquestioned by the judiciary, by the senior civil services, by the media, and legislature, importantly, because we're seeing that the opposition parties lack a lot of the moral courage to question, and they don't have the support and the coverage and the resources that of their voices being amplified. And therefore, we're seeing actually the opposite. We're seeing a completely unencumbered executive and the consequences of it. And that's what I've written in my article, that as long as other people were affected by it, as long as the poor migrant was affected, as long as the Muslim was affected, we celebrated us in the middle class, the powerful, unencumbered, decisive executive. Now that our loved ones are not getting a hospital bed, we suddenly are getting a sense of outrage. But democracy works with countervailing institutions, which we have watched and supported their destruction. So quite the contrary. We are seeing the consequences of an executive that never was as powerful as we see today. Yeah.
So, Harsh, with your permission, maybe one last set of questions.
And that last question, sorry, about which Deepak had asked, how is the government responding to criticism? It's a great question. I think that the playlist is very clear. Let me just give my own example. I chose to leave the IAS in 2002 because of the horror of what I witnessed in Gujarat and where I saw my country going. And I wrote a piece then, Try My Beloved Country. I spoke about that this is not a state-sponsored massacre. It's not a riot. It's a state-sponsored massacre. And as a serving IAS officer, I know that no so-called riot can go on for even more than a few hours unless the state wants it. And this has gone on for weeks, and so on and so forth. I thought that was the darkest time that we would pass through. But when I look back at 2002 and I look at now, in 2002, we still had, the Times of India published my article. We had television channels, questioning. We had many of us, I relocated to Gujarat, other people, Mukul Sinha, Tista Setlavad, many others took up cases. The Supreme Court was extremely active and intervened. The National Human Rights Commission, we've forgotten that we even have one under Justice Verma at that time. intervened on behalf of the victims. Mr. Modi was not finally prosecuted but he was still presented and had to give evidence before an SIT. All of that is unthinkable today. And not only has all of that become unthinkable today, to give another example, I was a member of the National Advisory Council in the last government for some years, and which is actually an advisor to the Prime Minister. And in my columns, every other column, I would criticize the Prime Minister roundly and his policies. And I was an advisor to him. I mean, it would be unthinkable to be able to do that today. The closing of our democratic spaces. But what has happened after the Delhi riots is, justice has not happened in communal violence after communal violence, riot after riot. But even in Gujarat, it didn't, nobody, when against me or Tista or Mukul Sinha, it was not that the government then filed cases against us saying we were the conspirators. We wanted to assassinate the Prime Minister or the Chief Minister. We were part of an insurrection and a conspiracy. But that is what has happened today. In charge sheet after charge sheet, my name is mentioned as, and filed in the Supreme Court and the High Court, claiming that I was hate mongering and planning an insurrection. Along with various other people, we've already seen largely younger people so far, including some women have been jailed under UAPA. And for some of us who are more senior, we are mentioned in many charge sheets. It's only a matter of time. So, so there's a clear sense that, and Kapan's case, as a journalist, he happened to be Muslim. He came from Kerala to report on the Hathras gang rape, and he has been in jail for months. And the last few days, he was chained to his bed and not even allowed to go to the toilet, and they had to approach the highest courts for some relief. Dissent has become extremely dangerous. I think that I was talking about how the media, the Human Rights Commission, the judiciary, the higher civil service, all of these and their countervailing authority has anyway collapsed and been systematically decimated. But the one lasting in academia was really civil society, where voices of dissent have continued, although in a smaller and smaller degree. And it is this that is sought to be crushed by charging us with the worst kinds of treason, terror, sedition that could keep keep me in jail for the rest of this life and probably most of the next. And through that, and our resolve of a few of us has been that whatever they do, we'll continue to speak out. Because that is the only way that we wish to respond. But the dissent has never been as dangerous as it is today. We've seen the emergency, political dissenters were put in jail in a formal emergency. The media was controlled, and that is the only comparable time. But in the undeclared emergency of today, what is worse is that it is also a hate project of unequal citizenship, of establishing a very different country from that which we had through the freedom struggle and in our constitution writing with Dr. Ambedkar, we had promised that we would be a country, a humane and inclusive country, where regardless of your religion, your caste, your language, your gender, your wealth, you would be a fully equal citizen in every way. That is being destroyed before our eyes, and dissent is being crushed for that reason, because that project is very advanced at this stage.
Thank you. Thank you very much, sir, for participating here and also giving us a depth view of not only what is going on today, but also how did we reach here. Forgive me, fellow participants, Lipsa, Sumana, Pritish, and Aditi. With the constraint of time, we are not able to take the questions right now. It would be great if you can leave these questions in the chat box. We'll try to reach out to you and connect Harsh and get response and reach out to you. We are also doing a follow-up to this. This is just a part A of what we are discussing. Next Friday, we are doing this Friday, we are doing a follow-up of that. One thing I think after listening to Harsh and also being part of this journey, this course with Dr. Suresh and BA Barefoot Academy for last 3 years, I think what I have personally received from the course is hope. Never lose hope that change can happen. Of course, the pandemic is killing our people at this point of time, but we will survive, we will change, and we will bring change. And is any one of you, if you are interested to know more what we do in the course, how we interact, what we talk, we are building a community of concerned citizens, what we try to call them as a concerned change agents. If you are more interested, one of our colleagues and friends will put up a link here. Just drop in your contact details. Someone else will get in touch with you. Someone from us will get in touch with you. This is not the space where we'll talk about it, but it has been an amazing last 2 hours where where you asked really genuine questions, concerning questions. I hope you get few of the responses. You got few of responses. This is a complex problem. This is a wicked problem. Let's not expect to get all the answers today, right now, but it is always great to take a step and start the journey. And I am very much hopeful that we have started the dialogue. Now I would like to call Dr. Suresh, who is the Dean of Barefoot Academy of Governance, also a well-known lawyer in Madras High Court, General Secretary of UCL. He wears a lot of hats. He is our teacher, guide, mentor, friend, and we would like to invite him here and share his closing thoughts for the day. Thank you, sir.
Thanks, Abhijit. It's wonderful to see so many young people willing to spend about 1.5 hours to listen to Harsh. And Harsh, thanks for a very, very heartwarming sharing, which was both talking from the heart and also sounding from the head. Something that I keep talking about with many people. I was just looking at the notes I made of your talk, and there's several points that you keeps repeating. And I would invite all those of us who are listening to this to keep this in our mind and to ask us the question, what are we going to do? I know the situation is grim in terms of the COVID crisis. The situation is also grim in terms of various other parameters in the country. And it is in these times that we suddenly feel, can we do anything? Can we make a difference? Are we too small? And where do we start? I think all these questions do come in. Questions that Deepak had asked about criticism. Is there an accommodation of any type of a comment or a critical appraisal of the government policy? In a way, talks about what many young people are feeling across the length and breadth of our country, and we need to keep this in mind. Many of the questions that people have raised today is also something that is very noteworthy. That we have also asked many critical questions, and any journey of change starts by asking certain right questions. Now, you ask the wrong question, you're going to get a wrong answer. You ask a right question, and although it seems to be very simple, asking the right question is not so simple as it seems. And Harsh has pointed out to a couple of very important pointers. At the human level, he talks about how we have slowly become an uncaring society. We have become a very insular society, only wanting for ourselves and not wanting to think about others and what others would think. And it ends up in biting us ourselves when the chips are down, which is what is happening today. So the first question that Harsh has talked about, I think is the word that he used in the first part of his speech, is that of complicity. All of us who are listening to this talk, or rather most of us who are listening to this talk, come from another word that he talked about, which is that we come with some semblance of privilege, if not a full privilege. From our privilege, I think it's a very hard knock on our head when we are told that you're also complicit in what has happened. And I think these are questions that even I ask in the course, and in with the students that we go through this course. It's wrong to call it students because they're all young professionals who want to make a difference in society. And this change I've seen from 2015 onwards, during the Chennai floods and during various other disasters that India has gone through in the last 10 years. Harsh and I were together in 2004 during the tsunami that struck the southern coast, particularly in Tamil Nadu and Kerala. You know, now, there is something which is very heartwarming in recent times is that many young people are saying enough of finger pointing, enough of blaming, enough of saying that the earlier generation has betrayed us. We need to get our hands and feet dirty, and we are going to get into the arena so that we can start the long haul of bringing about change. And that's the second part of what Harsha talked about. From an uncaring society, how do we build a society based on solidarity? How do we build ourselves a society with a new ethos of relating as human beings first, and then as whatever other status positions that we hold? In that process of discovering humanity in ourselves and the fraternity that Ambedkar talked about so eloquently and put it into our constitution, which was in a way very ironically discovered by us in the end of 2019 and early 2020 in the post-CAA protests, when across the length and breadth of India, ordinary citizens, young people, students, teachers, lawyers came out and read the preamble of the Constitution. It was a very heartwarming experience when people went back to the original document that says, we, the people of India, give to ourselves this constitution. Very easily we have forgotten that. And in that constitution of fraternity and liberty and freedom, which our forefathers had thought of, every time we read it, we are reinterpreting it and we're reasserting that as a nation, we may have become like this, but we need not become like this. And that is the second part of what Harsh had talked about, which is to say, when systems have been dismantled, perhaps not in many of your generation, but definitely in Harsh's and my generation, and I saw a few other older people in the course in our generations, we saw the way public system function. Now it's an anachronism if I were to say today that during my generation, no young person from a middle class home will go to a private school. They only wanted to go to a public school. I remember when I was a youngster and I was forced to go to a private school because I was transferred in the middle of the season, and I couldn't get admission into. I know this will sound completely weird today, into a corporation school in Chennai. I came in from the north, and I couldn't get a corporation school because it was a coveted admission. That I didn't get it, and I had to go to a private school. Friends, from that in my own lifetime, from that situation to today, where people from middle class homes do not want to go into the public schools but want to go to private schools, is the change that has taken place in our own lifetimes. I'm pointing this out to also point out to what Harsh had pointed out. Therefore, if we have to change, we have to reinterpret and renegotiate the social contract. Our freedom fighters and the constitution makers went into discussion for over 2 years to evolve the social contract in the nature of the Indian Constitution. It was a solemn contract. It was a dream of people who dared to dream in 1947 in a nation of 34 crores, when we are a nation of 138 crores today. The entire 34 crores was in a much different economic situation. And in the last 70 years, 38 crores has now become 138 crores. That is the type of change that has taken place. What has happened to that dream? The situation of the dreamers of the Constitution, of Patel, of Ambedkar, of Nehru, of Rajaji, of many other stalwarts of that period who dared to dream of a different India. That dream of an independent India is in question today, and COVID raises that question. And COVID raises that question, what is our public policy going to be vis-a-vis public institutions? Do we allow our public institutions to be run for the public, by the public, or do we allow privatization to become the norm, especially in some of the core sectors like health and now in education? Now, if we have to reimagine what India is going to be 20 years from today, let's also not forget what has happened in the height of COVID. That remdesivir, which costs 6,000 rupees a vial, is being sold at 30,000 rupees by some hospitals who say they don't have that. And I personally know a family, a friend, who coughed up 1.5 lakh rupees per vial last week so that they could give their parents the remdesivir. 2 doses at 1.5 lakhs, and 2 parents cost them 6 lakh rupees. And the father died yesterday. Something which should have been a right that they should have got. They were willing to spend 1.5 lakh rupees so that they could share and they are now asking the question: is this the type of privatization we are talking about at the time of vaccines? Should privatization be there based on vaccines? If we have to be universal, how do we do it? And those questions are now being raised. So to young friends, like I think it was Deepak who had raised, what can we do? And several others have said, what can we do? We do by asking questions. We do by asserting that there are some values which are not available for sale, that we are not going to compromise them. We start this long journey by asking the questions and by saying we will continue to ask those questions. Like Harsh was saying, we don't want charity, and the poor don't want charity. I've been working with the poor for the last 35, 40 years. Poor don't want charity. They don't want our money. And it is charity which makes them beggars. And it's the state and the ruling parties and the ruling elite, which means you and I and our parents, who make beggars out of ordinary people. They want dignity and they want to lead their own lives and they want solidarity. Can we extend the hand of solidarity with them? Especially during this COVID time, can we come out and ask questions? Can we come out and ask for accountability? Can we come out and demand responsibility for decisions that have been made in our name? Do we subscribe to it? Or are we going to remain quiet and therefore become complicit in it? So friends, there are no easy answers. I wish I can give you a sugar-coated pill, but Harsh beautifully said it. There can be no sugar-coated pill because it's your tomorrow. Harsh and I now belong to a generation where very soon we will be on our way out. It's your generation which has to take charge. Do you have the gumption? Do you have the spine? And do you have the heart? Do you also have the head to be able to stick on, not only in blaming, but in beginning the long process of overhauling our entire democratic system? Because the COVID has now shown us one thing. The southern states, for example, has shown us what can happen when you have a robust public health system. If you look at Kerala and you look at Tamil Nadu, you will find that most people are preferring to go to the public hospitals rather than the private hospitals, despite the accusation of it being corrupt, it not being clean, it not being X, Y, Z. They yet go back there because it's in those public institutions, those public hospitals, that you have trained doctors who will be able to find out exactly what is happening and what to do. That is the issue before us, friends. And that is why we, when all the students of this course said, we should start this process of raising questions and open it up in a big way, they decided to go. I said, let me be a co-traveler with you in this journey. I'm very happy that Harsh came along with us in this journey because he's a co-traveler who's a long friend and he's also part of various other travels. And I wish that Harsh will be with us, and I'm sure he's going to be with us. I will only say one thing to the organizing group which has set up this Samvaad. There are many more questions which have come which cannot be answered. We are going to have one more lecture day after tomorrow, and we'll put up the poster for you all to see. Is the COVID crisis, what is the answer? Strengthening public systems or privatizing healthcare? What path do we take? This we were thinking of a little earlier, and Harsh also talked about it. What path do we take? I think these are questions which can no longer be put forth for tomorrow. These are questions which we have to ask as the crisis is unfolding. There may be some clear answers, there may be a lot of confusions, but in asking the questions, in articulating the confusion, in saying that we care, I think we make the beginning, and that's the beginning we make. I would like to say to the organizers and also to many of you who are still in the talk, please do talk to your other friends. This two talks, we have two very, very experienced people who have been working in these fields for long to share with us. We can continue the discussions. We can have separate samvads where all of you can talk and discuss with each other. I'm sure friends like Harsh, given the time constraint, if and when they get the free time, they will be willing to join with us. I know Harsh for a long time, and I know Harsh takes special care to be with young people when they're sitting down to say that we care, and we care enough to take the risk of working on change. I would like to say thanks to each one of you, the more than 50, 60 people who are still remaining at the end of almost 1 hour and 45 minutes. It's very heartening. It's like a dose of injection to us that you are still remaining. Thank you all. And I hope to see most of you on Friday. Please do pass the message along so that more can come. And the samvads will not end with these two talks. The samvads end when we have local samvads in the various cities and the towns. So please do come, please do talk, please do attack. And I would like to end up by saying the samvad is a place where we don't need to necessarily agree on everything. Samvad is a space where we can articulate things that we agree with, and very importantly, things that we disagree with and disagree with strongly. Because that space does not exist in India today. That space has been robbed away from us. It's a space which is ours. It's a space of the next generations. And we need to bring it back again into the center space. So Samvad doesn't mean that we all talk in the same part. We can fight, we can argue, we can debate. But at the end of the day, when we extend our hands of solidarity with one another, in which we say, I disagree, and like what Voltaire said, I will fight to the end of my life, even though I disagree with you. That is the spirit we want in India today. And that spirit can come about not by wishing for it, but by laying the foundations brick by brick, by starting the process step by step. And we hope that this process has started, and we also hope that you will be part of this journey. This is not a journey of any one set of people. It's a journey of all of us for the India that we want to be behind. Thank you.
Thank you, sir. We would conclude the meeting here. I would not say end because it is another beginning. And for Friday's session, we will send you the registration link in your email address. Please do register to attend the session, as sir mentioned. Also, pass on this information to your friends who are interested to attend. Thank you, everyone. Thank you, Harsh sir. Thank you, Suresh sir, and everyone who has participated. We would close the meeting right now.